like to welcome everyone to our Tuesday, May 30th Atchison County Commission meeting. I'd like to call the meeting to order, and please join me in the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. First item is public comment. Everyone's here for an agenda item, no public comment. Additions to the agenda, I have a purchase order from Solid Waste to present later in within the agenda. Reading and approval of the minutes. We had discussion about the May 15th minutes this morning, and any changes proposed in the future to minutes will be done at this time during our meeting, so that everything posted will be reviewed and we'll know what we're approving. So we'll make some alterations to the May 15th. Do I have a motion to approve the May 23rd minutes?
So moved. Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Aye, passes 3-0. Commissioner comments and committee reports. Commissioner Rivas?
Just a project concern meeting. Attendance is getting better at both centers, and more activities are happening. So we're not back to pre-COVID numbers, but it's trending that direction. So.
Okay, I have a NEK multi-county health meeting Monday night.
Okay. All right. I don't have any comments this week. So we will start with Adam Buman-Wiggs from the Guidance Center, going to do a crisis center presentation.
Okay.
And one of the things Commissioner Knoll had arranged this, but we thought it'd be nice to do introductions so that everyone knows everyone. So.
Certainly. All right, so yes, I'm Dr. Adam Buman-Wiggs. I am a clinical psychologist and the new CEO of the Guidance Center as of April 1st. I took over the position after the retirement of our predecessor, Keith Rickard, whom I'm sure you're well acquainted with and oversaw the Guidance Center for 32 years. So I've had about 14, 15 months under his mentorship to step up to the role, and I'm happy to be doing that now. One of the many legacies that we have to offer now from Keith's work and the center's work is our new Crisis Stabilization Center. The Guiding Lights Crisis Stabilization Center, which we call GLIC for short. And as part of presenting today, I've brought two individuals. The primary person who's going to be talking about it is our director for GLIC, which is the gentleman right here in black, Carlton Quattlebaum. So he's going to share some information about how GLIC operates. I've asked him to bring some information regarding specifically the services we've already provided to Atchison County residents. We do serve 7 counties with that center, and hopefully give you a nice overview of what we have to offer and what we'll be looking forward to in terms of future collaboration where crisis stabilization needs are concerned. So it's okay, Carlton, go ahead and introduce yourself.
Good morning.
Good morning.
It's good to be here this morning. Thank you for having us. My name is Carlton Quattlebaum. I'm the director of GLIC, as Adam said. To give you some idea of who we are and what we're doing, the center is, even though we're a crisis center, we're a non-medical facility. So it says so on our front door. It's like, this is a non-medical facility. If you have a medical emergency, to go to your local emergency room. We have a staff, when we're fully staffed, of about 20. We're not quite there yet. However, we are. We started off with a abbreviated schedule, like 8 a.m. to 8 p.m. We're now 24/7, and so we have enough staff to support that. Our staff includes therapists. Medication providers are actually not part of that number because they're part of the Guidance Center and provide support, but they're not part of our staff directly. We have case managers, charge case managers who supervise the individual shifts. We have techs, mental health techs, who provide direct services to the clients. So we have med providers who are there right now 3 mornings a week, Monday, Wednesday, and Friday. We have a medical director who is the medical director for the Guidance Center, who provides medical counsel to us. And we also, because we are 24/7, we have on-call clinicians who are on call around the clock. So if any needs come up, and of course they do, that our staff there, many of them, like our case managers are bachelor's level, so they rely on the clinical counsel of those on-call clinicians. So we are licensed for up to 16 clients at a time. We have 4 stabilization beds. The individuals who are there could be there for hours to maybe a couple of weeks, depending on their need for stabilization, their severity. Sometimes they would be there as we are working on discharge planning for housing, for appropriate placement for them. So it is completely dictated on the person's needs. Sometimes they're there for hours, sometimes it's much, much longer. We have an observation unit, which we have 8, a capacity for 8 in that. And that would be a 23-hour placement. So someone could be there overnight, but not nights. They would come there if they have mental health symptoms that are dysregulated that need to be stabilized, or if they're having suicidal thoughts, suicidal or homicidal thoughts. We will take those clients who are suicidal. If they become actively suicidal, we will refer them out for a higher level of care. And then we have a sobering unit, and that's for individuals whose intoxication has rendered them unstable enough that they've been referred to us. And that again is 23 hours. The sobering unit would be the only place where typically they do not receive services other than monitoring. Due to their intoxication, they're not going to be seeing a therapist during that time until they're sobered up. And either they could move from there to the observation unit, to a stabilization bed. In our 23-hour units, we're doing assessment to determine what is appropriate. Are they, after a short period of time, are they ready to be discharged? Do they need a higher level of care, or is the level of care that we have there appropriate and they just need more time? So we have referrals. Our referrals come from the clients themselves. They can, it's voluntary, so presents a little bit of a challenge to some people who would be referring clients to us. Sometimes if someone is suicidal and they don't want to be placed there, family members could say, can't you just please take them and keep them safe? But if they're not willing to remain there, we have no basis to hold them involuntarily. That's another level of service that we're not able to provide at this point. We get referrals from the hospital. We've got a number from Atchison, from Amberville, and as well from police departments. We've had clients from as remote as Nemaha. We have had an average of about 2 clients per month from Atchison County, and over the 3 months that we've been, about 6 from Atchison County. We've had a couple that have been diversions from the hospital, that if they were not, we will ask them, if you were not able to be a click, where would you go? And in some cases, the statement is made, would have to go to ER. So this does provide valuable service in providing a lower level of care than an emergency room with all of the cost of that. So while they're there, we provide meals, we provide housing. As our census gets up, we will we'll be able to add more programming as far as group activity. We do individual activity with the clients now, and individual therapy. So we'll be able to do that more in a group setting as our census increases. We do a lot of case management, that is working with the clients to determine what circumstances cause them to contribute to their crisis so that we can problem solve and help them come to a better place, not only while they're there, but at discharge, that they're living in a better environment than they, that could mean referral to the guidance center for counseling or other community mental health centers, to other providers and other social services. So while they're there, of course, we do regular checks on our clients, 15 or 30 minutes, depending on the acuity. We do not refuse anyone based on their ability to pay. We do accept insurance. We do not collect co-pays, but however, if they're not insured, we provide services to them nonetheless. So we do provide walk-in crisis therapy sessions. So if someone comes in, they don't know if they want to stay at Glick, we will triage them, we'll allow them to see a therapist to determine what the next best step is. And maybe it's just talking with the therapist and sorting things out, and they go on their way. So, however, that would be the only kind of service that we would provide to walk-ins. We do, as I mentioned, we have med providers there, but they're not available for people just to walk in to see a psychiatrist at will. So, as I said, we provide services on a voluntary basis. If someone needs a higher level of care, we, based on our best assessment and consult with others, and they need a screen for state placement, then we will refer them to St. John's, which is a hospital in our area. Probably a note for some of you. There are times when we will require an individual coming to us to be medically cleared. We do not do that with every person that walks in the door, but if there is some condition that is evident to us, maybe as a result of intoxication, we don't know the level of toxicity, etc., or if there's a medical, if in our admission process their vitals are out of range, we will consult with our medical director. They say send them out to be cleared. So there are times when people will be sent to us. Before admission, we will require that they be medically cleared from the hospital. So, any questions as I go along this?
I had a couple.
Yes.
When you said the sobering unit, is that alcohol or is that drugs?
We have had both.
Both. Okay.
Yes.
I didn't know whether that was something that was separate, or because that could be a lot heavier.
Yeah, we don't have what you would call it like a full detox unit.
Mm-hmm.
It's basically sobering to determine what is the next best step for them. So We will assess, there's some assessments that we utilize if they are intoxicated to determine if there are some signs of withdrawal symptoms. And so we can identify those and refer that person out if things are going south. Is a good well with alcohol withdrawal particularly.
Okay, I'm going to ask questions as a layperson, because I don't know anything about the health community. I am on the Multnomah County Health Board, and I know that when I mentioned that the crisis center was to open there, they were quite excited that there's another resource. I mean, because that's the one thing I hear over and over is that the mental health, there's a lot of needs out there. And so I think that probably for the public out there is how, if you've got a problem at home, I mean, how do they access the crisis center? I mean, because, you know, if it's at Amberwell, you know, and they're referred, I mean, there's professionals there that have the basic understandings of how to do it. But, you know, what about the, you know, if you've got a family member, how do they get in the door?
It's a very low bar. They just walk in the door and we will make an assessment. If they can get the individual there, we will assess to determine if that's an appropriate placement. As I said, it is voluntary, but there may become a time when the best thing to do would be to call to see if we have capacity for additional, if we are not at census, we've not approached that issue yet. So
What about like weekends and things like that?
24/7.
24/7? Okay.
24/7.
Holidays as well,
Yes, yes.
365.
Okay. Yeah. I think that there's very little, until it's needed, there's no research or thought that goes into, you know, what if I need this? You know, everybody's thought, well, if I have to go to the emergency room, they know where to go. Where do they go if they've got a crisis? So that's the reason I'm kind of asking on that basis.
So I presented to Lawrence, or Leavenworth County EMS. It would be available to do so for Atchison. Sometimes it helps for EMS to know what the level, what exactly we provide, so that they can, and that they have the information. Because if it's not in a medical emergency, if it's something where they're called there because of the alarm and the frustration of a family member, it's like calling EMS. And now they're there and there's not a medical concern, they can make that referral and say, this really seems like a stabilization issue. And they would provide that information. EMS cannot transport to us because we are not a medical facility, so they could only take them to an ER. So they could take them to the ER, and we get referrals from ERs, Amberwell, St. John's, all the time.
Okay. How many partnering counties are doing this as we are? I mean,
Right now, seven.
seven.
Seven counties, pretty much all of our area plus Kansas mental health's catchment area.
So we have partnering counties. Do they still have access to the facility, or is it only ones that have joined?
At this point, it's only the ones that are sort of part of our established consortium. When we become a CCBHC on July 1st, one of our obligations is we can deny services to no one. So if somebody were, for some reason, to come from central Kansas to us, we would of course accept them and take care of them, right? We won't turn away anyone. But the understanding is that, you know, Pawnee would be the closest crisis stabilization center for them, and we would anticipate that they would go there. So, yeah. And I think of the 7 counties, I think 5 of them have financially supported us as well, including Atchison County, which is terrific. And so we're hoping to expand that financial support as well.
So generally, the need is just to get the person there. There was one instance where I personally picked up someone from Amberwell at the ER, and transported them to that. Typically, we ask that they get there at discharge, typically because we know that they're more stable, we will provide transport to them back to community if needed.
I think a lot of it's just knowing that it's there, it's open, because, you know, I think there was we knew that it was being worked on, and then you opened in, was it February or March? It was February. And just to get the word out that, you know, you're there and, you know, open for business.
You can take whatever you want to.
Something I would add to that is we're adding another leg to the overall crisis response by September, and that is we're going to be launching mobile crisis services as well. We're starting it in Leavenworth in collaboration with Leavenworth PD and Leavenworth County Sheriff. And we're pursuing a co-responder model where if there's a crisis in the community, 911 or 988 gets contacted, they contact dispatch, dispatch sends an officer to the scene, and dispatch will also call our mobile crisis persons. And they will also go and they'll stage nearby. As soon as law enforcement says it's safe, our staff will move in and address the mental health issues. So we're going to begin that program in Leavenworth and then hopefully expand it to Atchison and Jefferson counties by next summer. So you'll be hearing more from us on that. But I was thinking of that when you were describing that circumstance in the home. What do we do with this person in our house? Eventually, mobile crisis will be an option. They'll be able to call us and we can send law enforcement, a qualified mental health provider and a case manager right to the home and make an assessment and go from there. So it's huge,
Yeah.
It's huge. It's a tremendous demand. And that service is coming very soon. It'll be functioning by September in Leavenworth County, and then we'll expand from there. We want to get a good working model in Leavenworth and then be able to just sort of bring a solution to Atchison and Jefferson and say, this model works, will you help us staff it? So that'll be coming soon too.
I don't know what your marketing's like, but I think business cards and like waiting room at the hospital and things like that, where you catch people that, because it's not something they want to advertise that I need this, or I have a family member that needs help, but to have that number where you can call ahead, I think would be fantastic.
Yes, absolutely. And we're actively seeking an assistant director at the stabilization center to free up Carlton for exactly that. You know, the two centers we talked to, RSI and Pawnee, as we were building this program, made it quite clear that their directors were on the road all the time. Their directors were going to law enforcement, EMS, all over the place because staff changes, right? Everybody needs to be sort of re-educated about what their crisis stabilization centers do, and we're preparing to do exactly the same thing. So Carlton will probably be making the rounds 2 or 3 days a week through all 7 counties coming up here this summer, as soon as we can hire his backup to be in-house.
So one of the things that we do, as I said, we're not medical, but if a client is there and has a medical need, and it's not to the level where they need to be hospitalized, we will consult with our medical director. We've taken people to urgent care. If they come to us and they have, so there are a number of instances where we provide transportation to them, for them to some service. We've taken people to 12-step groups, to emergency, to urgent care. If they come and their meds are at home, we've taken them, driven them home to get their meds so that they can have those on board with them there. So there's any number of reasons why, particularly once they're there and we know that they're stable and safe to transport. Until then, we will contact EMS if there's a need to send them out for medical clearance or another need or to be screened. We will contact EMS, particularly if we do not know that the person is stable enough for us to safely transport them.
One other detail he didn't mention, but is implied in all of this, we can only accept legal adults.
Yes.
So it's 18 and up.
Yes.
We hope one day to be able to serve children and adolescents as well, but that is quite literally an entire different story. in terms of certification and training and services and so on, and we just don't have the foundation to be able to do that yet. But we recognize the need, we hope we can get there.
Now, that's for your inpatient, but what about your mobile unit when that starts? Will that take care of it?
Mobile crisis, as I understand the formulation, will serve anybody who calls. So that will be limited to adults.
Still adults, okay.
Yeah, so I anticipate we may be sending people to schools, we may be sending people to parks. You know, there'll be lots of places we'll send. That's one of the reasons we'll have both a QMHP and a case manager, so that we can assess clinically what the need is, and then the case manager can help make connections with services, talk to family members, get them engaged with whatever they may need. And we'll probably pick people up and take them to GLIC if needed too. So the mobile crisis and GLIC are going to be very closely intertwined moving forward.
About 5 years ago, the legislature adopted a Crisis Intervention Act, and the care and treatment statutes were amended to allow officers to take people that were acutely in need of mental health services to a crisis intervention center. You're not an intervention center, you're a stabilization center, so you're not using the same, and I suspect that's not an accident. The Crisis Intervention Act talks about taking voluntary and involuntary patients, and I understand you're not even licensed to take involuntary patients.
That's correct.
And I don't know if there's any, actually I looked and I'm not even sure that there are regulations on how to get licensed as a crisis intervention center.
My understanding, those regulations are still being written by KDADS and KDHE as we speak, so.
So using your crystal ball.
Well, I would say we absolutely recognize the need, and if there is a way we can do it and staff it and fund it, we will certainly make every attempt, but
Yeah.
we're at least a couple of years out before we could take any form of involuntary. We'd probably be able to take kids and adolescents well before we could take involuntary. We'd almost need a different facility.
I think right now, if we run across that situation, we've been taken to the hospital and saying, here's your new problem. And
Yeah. Unfortunately, that's a frustration that Amberwell has, St. John's has. If they're involuntary, there really are no other options until that screening process is completed. And then the adventure of waiting for an inpatient bed begins, and law enforcement often gets entangled with that as well. So we have no solid solution to that involuntary piece yet.
yeah. I don't either.
Any trends or anything that's happening now with the mental health? It's been such a stigma, and I think I've been hearing a lot more about it. I mean, it seems to be trending that it's a lot more open to talk about.
So in the past, there's been a lot of abuse in long-term placement of psychiatric patients. And so there's a really not much appetite for that kind of long-term placement, which places these patients in community generally, trying to access services to manage sufficiently, socially within community outside of a state hospital. Previous to this, I did mental health in the prison, and that's where a lot of people with mental health end up. And prison is not a good place for someone who is schizophrenic, and yet they end up there a lot. So because of that, the lack of appetite for permanent placement for many people who need a secure environment, that's where we come in, because at this point, we've seen about 70 individual patients, some of whom have been there several times already in the 3 months we've been here. So we know that there's people who struggle with functioning in community, and we will see them regularly and try to get them in as stable as we can and sometimes they'll choose to leave because we don't allow smoking. So whatever would cause them to maybe leave before they're completely stabilized, chances are we will see them again.
Amy Folsom, the Amberwell Emergency Room Director, would like to ask some questions.
Oh, sure.
Okay.
Well, I think we just struggle as a facility knowing how to make referrals to you and what types of patients are appropriate. I think in Atchison County, police, sheriff's department, EMS, walk-ins, everyone with mental health comes to the ER when they're in crisis or when they run out of medications or whatever the case may be. I think the patient that you came and got from us was actually somebody that was referred from the guidance center that we did a medical clearance on. So I don't know that we've actually made a referral, as an ER patient that we've referred, because we're just struggling with what that looks like and how that works. So what are you seeing from other emergency departments, and how would you advise us to best make those referrals? I think most of the patients that we have, we screen. And so then once they're screened, they're either placed or they're voluntarily, which can take a couple of days. They're placed involuntarily, which can take many more days than that. Or they're sent home on a safety plan, which usually involves the guidance centers here in town. So how would you suggest that we best utilize your resources?
So there are times when it's appropriate to have someone screened for involuntary. I would say that unless that's just abundantly obvious to anyone and everyone, I would make that referral, and we can assess and determine if we provide a sufficient environment for them to be able to stabilize. That's routinely what we get referrals all the time from St. John's, and they will typically, they're not far from us, they'll put people in Ubers and send them, because again, they can't have EMS bring them to us, but they will get them to us. And it's always helpful if we can get whatever documentation from the hospital, labs and things to determine this person is medically cleared and safe for placement. So.
And then you guys work on the placement, the voluntary placement, or is this just a safety plan?
I'm not sure. So we would take referrals from there and place them either in, to begin with, probably a observation on the observation unit, determine if they need to be in a stabilization bed. So.
Now, I am correct that the whole referral process simply would begin with a phone call from ER, right?
Absolutely.
You just call Glick directly and start the conversation, right?
Yeah.
So, yeah. But generally speaking, if they're medically stable and transport often comes up, if they can get transported down there, or in some cases, extreme cases, like Carlton described, he's come up and gotten somebody to take them down. If we can get them there, we will quite literally take the ball and run. We'll do the evaluation, we'll coordinate with family, safety, whatever's necessary.
Because I think that's another issue in Atchison is there's not that transportation. So
Yes,
discharging a patient and getting them to you is very difficult because a lot of them don't have vehicles. They don't have the ability to get to Leavenworth. I guess I'm talking more about the patients that come in that are already, suicidal or those types of things. We have the obligation to have those patients have a screening, a mental health screening exam. So, the guidance center or health source provide that service. But then, I guess we had hoped that you would be more of a place that we could send those patients then while they waited for placement, even if they were voluntary.
Oh.
Because we're still holding those patients. And the last 2 weeks, we've had at least 9 beds. We've had 1 bed occupied by a mental health patient every day for the last 2 weeks, and it's been a different one. It's not always the same patient, it's a different patient, but that ties up a lot of resources for us, especially, when they're involuntary. I know you don't do that, but.
And that is a problem. I mean, if they need a place to stay waiting for an involuntary bed.
Or voluntary, either one.
Yeah.
We wait for the voluntaries too. So that's where
Well,
we had hoped that you
I-
guys would be more of a place that we could put the voluntaries, send the voluntaries as they're waiting for placement. And I don't know what that looks like, and I'm not even sure under Intel how that works, but I was just.
Yeah, well, I kind of have to think about it. Is there any reason we couldn't have somebody voluntary who was waiting for a hospital bed if they're a voluntary patient?
That's been adjudicated for involuntary placement?
No, for voluntary.
Oh, for voluntary, yeah, absolutely.
Well, they don't get adjudicated for voluntary placement. The statutes don't, there's no way to, you don't need an order if it's voluntary.
No,
So
if they're
there's not a
involuntary.
problem.
But if they're waiting for a voluntary bed, right, you've screened them and they're a voluntary person.
Yeah.
So rather than having them take an ER room for, what, days?
Couple of days sometimes.
Couple of days? I think those people could absolutely come to us.
And then you guys would continue to work on trying to find placement, because sometimes that's our problem, is we can't find placement, there's no available beds. So that would be something you guys would continue to work
Yeah,
on.
in terms of the voluntary placement, yeah.
Okay.
Many times in fact, there was an Atchison resident that was with us for probably one of our longest periods of time, because we were trying to find placement for this person, housing and discharge. So, yeah.
I think she found her way back to us. Yeah.
Yes, I think we all know who we're talking about, certainly, yeah. So,
So yeah, so
So-
that would be good. Well, maybe we can start talking about how to better utilize you from our standpoint, from an Atchison County standpoint.
yeah, because that really is part of our goal, and when we talk about this service, we don't want you and law enforcement officers to be stuck in a basement observing 24/7 for somebody who's waiting for a voluntary placement. That should be our job. If it's an involuntary, we can't solve that. But if they're waiting for a voluntary bed somewhere, they should absolutely come to us, I would argue.
Thank you.
Corey, do you have any questions?
Would it be possible for you to provide, I mean, you have your brochure here, but to provide maybe an in-service for my staff and provide some materials? I mean, we're gonna be very limited in a lot of circumstances on what we can suggest. We're under medical control and have protocols, and I knew I wasn't gonna be able to transport directly to you anyway. We don't have a mental health destination policy or protocol.
Correct.
But in those instances where these individuals voluntarily refuse our services, to be able to give them a card or a brochure or someone that they can call before we leave would be great. A little in-service, something where your staff can come up and
Absolutely.
coordinate.
As I said, I was recently did that for Leavenworth County and went several days in a row to catch everyone and make sure that they had all heard the same information. And we can set that up today if you want.
Yeah, that'd be perfect. I'm here all day.
Yeah.
But yeah, just to even have the brochures on the ambulances.
That's exactly what they have, is them on board, where they can just, because you get those calls, and, yes. So for them to be able to say, this is more appropriate for what's happening with this person.
Yeah, that would be wonderful.
Yeah,
Yeah.
okay, stick around and we'll talk.
Yeah, I work right in the building, so catch me as you go out the door.
I think those same brochures could be in the health clinic and the county clinic and any destination there to be able to reach. Like I said, people are pretty private about that, and if they can just pick up a brochure, they can access you without having to go ask for help. People don't like to go ask. Any more questions? I'm sorry. I
No,
don't mean to
no,
take-
you're fine. I was just looking around to see if anybody else had anything that they wanted to. Okay. Well, thank you guys very much.
Yes.
Very
Yes.
informative and.
Thank you, you bet.
We appreciate it.
To be clear, were we on your docket to talk about commission funding? Are we on that list as well for today?
Yep,
Okay. thank
if
you.
you're ready, we have time.
Whenever you're ready, I guess.
Yep.
That part I would turn over to Jerry when you're ready.
I sent packets, do you have them?
Yes, sir.
Yeah, okay. Well, first of all, I just want to say we're very grateful to the funding that you've provided in the past, and especially the GLIC funding, which was enabled us to initiate that services. And our client numbers have not returned to pre-COVID levels, but we did see 940 Atchison County residents during 2022. And we also see, and they're not identified to me by which county location saw them, but a substantial number, several hundred of out-of-state clients. And my experience, you know, when I handled in the old days crisis intervention cases, a lot of them came across from St. Joseph. So Atchison County handles more than their share, and the hospital sees quite a few of those too. So that is something to always keep in mind, you know, if they, and we see a lot of crisis, and I know the police and the EMTs can verify this. We see a lot of clients that a lot of times uninsured, especially, that will travel from emergency room to emergency room to be seen. So, but most of the out-of-state come from here. At this, you know, at this time, we're asking for no increase in what you've provided before. We're just asking that you maintain that current level of funding. And I have attached a copy of, you know, proposed budget. And as Adams stated, July the 1st, we will implement a new funding source, you know, which should be, you know, very beneficial. Our rates will increase, but at the same time, these teams, mobile crisis teams and ACT teams, and the new services that we are required to perform, they're all very expensive. I mean, we're hiring registered nurses and you know, nurse practitioners that can prescribe, and we're competing with some centers that are already CCBHC, and they're already paying higher wages, so we're going to have to pay more for therapists, and so our revenue will increase, but our expenses will increase. But we are we're projecting a profit, modest profit for this year once we transition to the new system, and we're projecting a profit next year as well. But you know, we're still a nonprofit, and so you know, relatively modest profits for both years. But subject to your questions, and you know, Adam, you know, has his accomplishments. My biggest accomplishment was transitioning and getting the GLIC open, and we sort of had a perfect storm. We entered into a general public transportation contract with the city of Leavenworth, and the GLIC and that project was delayed for, you know, COVID reasons, and they all hit at once. And you know, we had this very detailed cost study due January 31st for our rate, you know, that we would be paid as a CCBHC. So there was a lot of things happening at once, and then we're also transitioning to the CCBHC, and so it's just an awfully lot of things going on right now, but we certainly appreciate your support. So, subject to your questions, you know, that concludes my report.
How are we doing?
The guidance center, they have transportation, correct?
Beg your pardon?
I feel like I might have seen a bus or something at the public schools for the guidance center.
We do.
Okay.
We have
17, 18 vehicles, and we use them in Oskaloosa, we use them in Atchison, we use them in Leavenworth, and they're primarily to pick up our psychosocial clients. And many times the psychosocial clients are clients that would normally be in a PRTF or psychiatric hospital, but we, especially the adults, we pick them up, bring them there, they have breakfast, and they have activities just like they would have in a psychiatric hospital. And so many of those clients, you know, don't have transportation. So we have a fairly robust, if you don't pick them up, they don't come.
Well, and that's what I was wondering to Amy's comment earlier of not having transportation from the hospital, if that's something that could be utilized from Amberwell down to the stabilization center. But I was just curious, kind of,
Yeah.
I've seen them, and then to her point of not having the transportation from Amberwell, Atchison to Leavenworth, I was just curious, but
Yeah.
that's something you guys can.
Yeah, there are a couple of issues with it, and the Carlton transporting a client from Amberwell was truly a sort of a desperation exception, but there are issues with transporting actively suicidal people. That's one of the problems. But we're hoping that potentially transport like that is something we can facilitate with mobile crisis.
Okay.
Once that gets started.
Awesome.
Because then we'll have, you know, potentially even a law enforcement officer engaged in transportation too. So we will see how that unfolds, but.
Awesome, thank you.
Thank you.
Okay, so like the process would be if someone needed stabilization and it would use the GLIC. But then for ongoing care, they would be referred like to, if they were from Atchison County, they'd be using the guidance center here. So it wouldn't be necessarily transportation. Once they entered the porthole there, they wouldn't necessarily have to keep going there.
Not at all. As
Okay.
part of their discharge planning, we would make sure they were connected with whatever services they needed in our Atchison office, and then we would send them home or wherever they were headed, and then Atchison would pick up the ball and keep going.
Okay. Just for my understanding.
Yeah, absolutely. No, it's a good question.
Okay. I don't have any questions.
No, very informative.
Yeah, Mary.
Yeah, thank you so much for coming.
Yeah, absolutely.
Do you care if we keep those additional brochures?
No,
I want to
no,
share some
They are,
with
they are
the.
for
Yes.
you, and Carlton has some of his cards here to fling around as well, I think. Yeah.
How do we want to, everybody distribute these?
My hand is pulled back fine.
I have blood brochure, I need my name over here.
Yep,
Just one.
there you go. Yep. Okay,
Thank you again. We appreciate it.
yeah, thank you.
You need or want us to remain?
Yep.
You're free to go.
It's
There's no involuntary.
No involuntary.
See you all.
Yeah,
No
you too.
paperwork?
Thank
Yes,
you.
thank you all very
Nice to
much.
meet you, sir.
Thank you again.
Nice to meet you.
Thank you very much for coming up.
Thank you.
Appreciate it. Thank you all very much.
Bye. See ya.
Okay, we're running a little ahead of schedule. Can you keep going or take a break or? How do you
Keep on going.
1 minute break? Okay, I'm good with that because I, too much coffee.
That's right.
Yeah, well, I already got that off of the flight.
Squeeze in here, be fine.
I get overlooked down here.
All the time.
What about you?
Yes, I was kind of busy, but.
Yeah.
Am I gonna have to be soon? Maybe. I don't know, do they have a brake on them? That's the problem. If you don't-
I'm glad I texted you that. We were sitting out here
I
and
didn't even think about it.
I didn't either.
I'm glad
But we were
too, 'cause we
talking about
wouldn't have-
the guidance center. I'm like, I wonder if they know we're out here. I was like, speak of the devil, I should make sure you know we're out here.
Once you said it, I realized, like, yeah, the setting looked different at the last meeting, but no, we were gonna walk up there.
Yeah.
So,
Oh, well, yeah, I'm glad
so
that
I'm glad that you texted when you did.
And now I know where this is. I didn't know this was out here.
Yeah, this is a really nice facility. I know it makes sense for us to be in the courthouse. This layout, it's just
Yes.
it's nice to be able to have room for everyone to pull up to the table. And sometimes I feel like the conversation's better when you're sitting around a table versus like.
I think so too.
Were you listening when they were talking about they're implementing this September with Leavenworth County where we'll send a case manager and, like another mental health provider out, like in the public with law enforcement, like if you get called to need more of that on-site? I think that would be, they're gonna work out the kinks in Leavenworth and then hope to provide it to Atchison and Jefferson by next year.
How are you?
Good, how are you? Did you have a good long weekend?
Do what?
Good long weekend?
I worked all weekend, so it
Yeah.
just like.
Mine wasn't very relaxing either. I had something in a different town every day, but that's okay.
We had that last weekend and I was like, okay, we're not gonna do anything. So we got a lot of around the house things done.
That's what I
which-
was hoping to do, but it just didn't work out that way. So, that's the way it is sometimes.
Yeah. When you farm, you really don't
get
have
days off.
3-day weekends,
Yeah.
but then you might have a 6-week rainout.
Yeah. Yeah.
So,
You
it's.
get impromptu.
And I wish we would have one of those. We really need a multi-week rainout. It's getting desperate.
Yeah,
Because Atchison's had more rain than we have. Because they had some rain last week.
Yeah.
We have.
I don't know how much, to tell you the truth.
None of that.
Wow.
Okay, well, we're a little ahead of schedule, but everyone's here, so let's just keep on going. Joint communications discussion with city manager and city assistant manager. So, welcome, ladies.
Thank you.
Yes.
Do you have a, like, proposed format? I jotted some questions down, or? how-
No, just,
Okay.
I just wanted you to feel like you can just ask the questions, get
Okay.
the answers, and
Okay. One, just to kind of explain our desire to be here, was that there really wasn't public discussion about this change. The last that the city was aware of was through discussions both at the county commission and then at the former joint communications advisory board about developing bylaws. This change kind of without the opportunity to be part of the discussion or ask questions, it left some things that I wanna make sure we're clear on. First, I guess, making sure, I think the county commission will still maintain budget authority of the joint communications budget, okay. What is the process of, how will budget requests be vetted, developed, to be brought to you, and then through what channel will those come to you?
I'm confused.
so in my mind, I think it would be the same. Like, in the past, I feel our director, Kim, has worked with all agencies to know needs, because at the end of the day, she's providing us the budget, and to make sure batteries, radios, all the things are accounted for all agencies. Like, is that what you're
So-
looking?
The committee that will be developed will give the request to the sheriff, who will present the request to the commission.
Well, I think Kim's gonna do a lot of it though, I would imagine, is that right?
So I don't wanna speak out of turn, but I envision it to be the same.
Yeah, pretty much the same, I think, I mean.
Which in the past, it was she had talked to everybody about what their needs are,
Yeah.
so she could budget for them, and then brings it
And
to-
who she was talking to is basically the makeup of the committee representing the agencies.
Especially regarding radios and all that stuff, yeah.
Okay.
I think one of the first things we're gonna do is, which we've talked about, is we gotta determine what the county commissioners are going to agree that's gonna be purchased out of the sales tax. You know, it's never been really set and defined or,
That process began with the former board, I think, when you were still seated.
So that is
Yeah.
something for me that is very apparent that needs to be done, because we came from, prior to, 3 commissioners where one commissioner was very vocal about batteries not being included in what's purchased. At my last joint communications meeting with Mr. Campbell, we were talking about that, and to me, common sense is if you have a radio, you have a battery. Like, the batteries are part of the radios. Like, it felt nitpicky for so long that it's like, it's joint communications and it's sales tax, and anything to do with joint communications should be funded from the sales tax that's countywide for all entities.
'Cause I think there's even
And
like
again,
the
I'm only-
microphone components. There are smaller pieces to the
Right.
radio that
Yep.
are, okay.
Yep, which we talked about those too, the lapel mics, all the things. And at that meeting, one thing that was determined not eligible, but then we had discussion on our end after that, was the computers. Because we talked about computers, and I think it was Chief Weiser that spoke up and said, you know, I use it for that, but majority isn't for that.
Right.
And so we kind of like, that was the in limbo one, and then coming back here, emergency management and the sheriff were talking about, well, historically, like several years ago, that computers were. So again, I'm not an end user, so I don't have, I'm just reciting what we had talked about, because again, when it comes to equipment for joint communications, I don't think it should even be a discussion. It's paid for from the sales tax, but that's just,
So will that be a discussion that you all will plan to have like during budget time, or how will you?
I would like to see that happen. When I was on the Joint Communications Board, I think the problem was there was a lot of opinions. It was easier just to kind of agree and go along, but I think there needs some guardrails here. So I would like to see that the users all get together and talk about what's reasonable and acceptable. If someone is, you know, a little more reckless, maybe, and they seem to keep breaking radios, maybe there's a problem there. Maybe
But it also
one
must
guy goes
be-
for batteries every
Some
year.
agencies are bigger and some agencies have higher volume.
Oh,
So
right, right,
our
right.
fire department and some of the rural fire departments, we're probably going to have more repairs and replacements because of the
Exactly.
sheer volume of use.
So that's what we need to
and
weigh all that out and
numbers.
see what's reasonable, so. I know one of the concerns was the volunteer fire department's getting a laptop. Some of them didn't really need it, you know, and so there were questions there. Is there really a need? Is it just spend the money to spend the money? So I think it's just getting this policy. I know that's what the sheriff and I've talked about before, is that we really need some clear policies on who gets a radio, what's the bandwidth they're allowed. And I think that's something for the end users to have that conversation.
So that would be done under the sheriff, the committee you put together that would report to the sheriff to report to you. I think I'm trying
That's
to make
what
sure
I
that I
think.
understand if we have concerns or questions or needs regarding the budget, that we know the appropriate path.
That's what I
Okay.
see it. That's my opinion.
Okay, and then, this may not be things you've discussed yet, but things I'm thinking about, like, what's the process between, and maybe process isn't the right word, oversight, sub-in, whatever, between an approval of a budget item and deployment? If something's approved in the budget, and sometimes that happens, right? Sometimes things have to be deferred, maybe because of an unexpected expense, but what would be the process there if I was expecting, I think in 2025, at least prior, the radio replacements were scheduled. What's my path if 2025 comes and that's approved in the budget and it's not ready? What does that look like? And that's just an example.
Why would it not be ready? I mean,
That's what I'm asking. What is the oversight if it's an approved budget item and the deployment or the execution of that budgeted expense doesn't happen? What would be our path for that? Because if, for example, if we are budgeting or not budgeting for, in this case, paying for radio replacements out of the city budget, we think it's budgeted, it doesn't happen, we have already had to make adjustments for non-budgeted changes to our budget. I don't wanna be in that position again. So what would be the path in that case? Where is that gap between a budgeted item being approved and that budgeted item being deployed?
So historically, and I hate to be the only one speaking, but, because I'm only one, so I'm giving you my opinion, but I see it as this, we have a director of joint communications that presents the budget that gets approved. I think that you working with her to give your needs, and once they're budgeted for.
But the difference is there's now someone in between you and that director, where there was not before.
Well, so this was the example, because I've been thinking about this of like so many ways. Rewind a year ago, we had our director came before the county commission and asked for wage increases for her staff so she could get out of dispatching and be a director. We still had a board in place. We still had everything in place. The vote hadn't even happened yet in November. And she came before us, and there were 2 commissioners, because one was absent at the time. She had all board members standing behind her from the county, and the city board members were supportive of this. She told us, and we voted it down because we were 1-to-1. One supported it, one didn't, and it didn't get implemented. So those are the things where I'm like, in my head, for you channeling something, having one point of contact for you to, anything you have concerned about versus a 3-person commission. And as far as that example, if the money's budgeted for, she should have authority to spend it as she sees fit. Like,
so does she have the authority, or does it go through one more step before you? Will the budgeted items, if Kim had an expenditure, she has final authority on budget expenditure?
Well, there's a spending limit, so like the radio's gonna be well over the spending limit, so that'll come to us for final approval on that, so. But I don't see anybody, everybody's on board with the radio.
Those requests can go through straight to Kim, and she can relay it to me, and she can come to the board to the commissioners for approval for the purchase. If
Okay.
it's an additional radio, like we've had recently with the rural fire department, I believe came in.
Adding staff or something like
Yeah,
that?
yeah, and they needed a couple extra radios, and
Okay.
she brought it to the commissioners, and they approved it.
That was a hospital, we did base unit for the
Yeah.
hospital.
Yeah.
Okay, that's kind of what I want to know,
What's
like.
the limit of the PO?
Most of those.
It's 2,500 radio.
Okay, so my question really was.
With what we're planning with the new upgrade, for everybody, that'll be, a team effort of getting everybody's input for each individual department. Every fire department, everybody come together, and this is what our requests are gonna be very similar to what we did initially, and now we have a little more input, because in hindsight, there's a lot of things that we should have done differently at the time, so.
Perhaps,
Or
but-
we didn't factor in the kits for the motorcycles, things
Yeah.
like that, so those are all things that we know now that we didn't think of then, so. But, as far as those things, we'll have a seat at the table and be able to present everything.
So the oversight that exists to ensure that all agencies impacted by decisions made related to and funded by joint communications is a committee with Kim and the sheriff reported to the commission, but only for budget items to the commission, not operational, I think.
We have to approve the operational budget too.
No, I'm saying not operational budget, the operation of joint communications. If there was a
Right.
concern about needing a change to a standard operating procedure, I'm not the person to give a really intelligent example about that, but
That's why we
we
put
need to
sheriff.
understand, like,
Yeah.
this is a complete shift in governance of joint communication when it was governed by the agencies participating. A shift discussed publicly to coming under the governance of the county commission, and a shift not discussed publicly under an elected department head. We need to be clear, we're the largest user by volume of this, and I wanna make sure that we know, like, if it's a budget item, it goes through a path to the commission. If it's an operational item, it is under a separate elected department head. I wanna make sure we understand, okay. And then,
Well, and honestly, to make it streamlined, once we, as a commission, approve the budget, Kim should have authority to spend within that budget, and then if there's a question, shouldn't it go to Sheriff Lori? I'm just trying to, because at the end of the day, that's the streamlined process of if Kim needs help, she has one person that's in her corner helping her, like, and you have one phone call instead of, well, now I gotta wait till Tuesday and see, you know, what's discussed, because
The best
As
thing
a-
about this
as-
is-
If there's ever an issue like that, Kim can come to me and we'll figure it out. But as far as operational, if there's ever any issues operations wise, everybody knows the number, or Kim. If Kim has an issue with it, she can discuss it with me. So it really doesn't change anything operational.
Yeah, the nice thing is it's been like once a week you get the commissioners
yeah.
in one place, 24/7.
I understand that,
it
but
helps her.
changing the governance of a joint function does change things, and I think it's important that we can at least all acknowledge that. It does change things in processes, in going from a board of users that governed through an agreement to the county commission to another shift. It's a lot of changes.
Yeah, this was under Sheriff Calhoun, and then the Joint Communications Board took more of a role as an advisory group. So it's actually started out as a
It
sheriff
wasn't an
oversight.
advisory board, it was a governance board by the ordinance, I think. So it is a large shift, and I think talking about change in governance of an operation that affects every county resident, for us, it's an acknowledgement that it is a big change, and we didn't get I had to ask to come ask these questions. We weren't included, discussed. There was no advisory board meeting who at the last time was asked to have bylaws. It just felt a little bit quick to us. It's personally not what I would have done, but we kind of need to know like what we should expect going forward. What are the expectations? We don't know who's on the committee yet. I can make an assumption that it looks the same. That's not been identified. And that won't be up to you to set because it's not an advisory board that reports to you. So it would be nice for us going forward to have some things in place. And I would like, and we've talked a little bit about, some of these things have come up, but understanding from your perspective, with this decision that was made without input from all of the agencies, which we're talking about how important that is at this meeting, what are the benefits? Like what led to such a hasty decision that couldn't be discussed as a group? And then what can we expect? What do you deem to be the benefits we should expect? We've talked about one point of contact. What other benefits should we be able to expect from this second pretty frequent change in the governance of this?
The staff has been understaffed, I don't know what they're saying for years. I mean, we haven't been fully staffed for a long time. And it's been one of our challenges that we need to have a director who can be a director and not be on dispatch all the time. So one of the primary objectives is to help empower her, along with the sheriff, to help her get the staff fully in place. We've increased wages and, the citizens aren't served well by overworked or understaffed dispatch center. I mean, if a big crisis would happen, it could be a real problem. So I think that's one of the biggest factors is that.
for me, it's just the overall makeup of it and the hierarchy. I feel like having, and again, rewind these past few years, like when I say Atchison County, I mean Atchison County as a whole and the cities in that county. Like sometimes the narratives before was county means rural, and county to me is everyone. And having the elected sheriff that is elected by all citizens of Atchison County be the person in our joint communication director's corner and oversight. They're residing in the same building. The sheriff works with all agencies as well. For me, I know the history, we're all aware of the history, and I had to remove personalities and history from the decision and move us forward of what what makes sense. And it's not about the people holding positions, it's about the hierarchy and what makes sense versus, and that example was one thing when the commission are over decisions and every one of the board members is for a decision and the commission votes it down, that's kind of, we would have been in a place of hopefully the director having the director's position a year ago if we had this makeup. I think that, I know there's fears, I know people are scared because history does play a part, but at the end of the day, there's a job to do, and whether you're elected or appointed, safety is the priority.
With all due respect, some of the fear comes from the fact that I'm asking questions today that you're looking at each other without an answer. I mean, big changes deserve development and discussion and a plan. Personally, my fear is that there isn't a very good one or a solid one right now. Not that it's bad, there really isn't one.
I appreciate you saying that because I feel that about every meeting and because I'm one of three, and that's why I think now having one elected official develop a plan that works for all is helpful because
Commissioner, generally when a plan of this magnitude is done without an agenda item, it would have been developed to the point of at least you being able to say, people that are impacted, this was the decision and these are the changes you can expect. And we had to ask to come to you to ask questions. That's the scary part, is that a very important decision was made and there really aren't all of the answers vetted yet. And that's, we have to know what those are. We are a user of this operation. I'm not suggesting the plan will be bad. Right now, there isn't one that is at least being communicated to your largest user
I think
of the
we made it
dispatch center.
clear, things are going to stay pretty much the same. I mean, it's just more about a matter of getting better staffing. There's still gonna be an advisory board in place.
But it's not yet, Commissioner. It's not in place at this time.
Well, I believe the sheriff's working on that. That's his call. It's gonna happen. I honestly don't think it's anything change.
And maybe not.
So,
The fact of
but
the
to say
matter
we
is
don't have
those are
any
not.
plan is really unfair.
But not, you have not communicated.
What's changed?
That's what we're
We
here
have
to ask.
better lines of
Like,
authority. He will do his job. He has no intention, I don't think, to destroy it.
I'm
So,
not.
I mean, there's the
Okay,
plan to keep
I
it
do
going.
wanna, I wanna call a pause on that, cause that's not the tone of my discussion here.
Okay.
The tone is, we don't know what to expect at this point. And
Public
it,
safety is what you could expect. The dispatch center doing its job.
I certainly hope so. We all hope that as a resident of Atchison County, the end goal is calling for help and getting it. But it is important that the agencies that are involved in this operation understand what are our expectations, what are the expectations of us, what is our level of input. I think these are fair
Yeah.
questions to ask. I think it would have felt more comfortable if some of these could have been given to us instead of having to come and ask you for them. That is my position.
I've offered to give you that.
After Commissioner invited us to this meeting, and I wanted to do this first, and I did reply to you on that. Yeah.
well, and so that was one of the things for being one of three commissioners, when your director of joint communications expresses some challenges they're having that are well beyond a Tuesday few hours of helping her address them, and public safety was a topic. That's my haste of moving forward, because, and also the fact that our sheriff is elected by all of the county, including the city, and at the end of the day, every emergency agency should be working together for the betterment and the safety of the public. To answer your question, I'm one of three, but I hope you see I hope the changes you see are for the better. There's no changes nobody's going to cut your funding or tell you can't get a radio, or, all the things that, oh gosh, what's that gonna look like now? Now the sheriff's in charge. What's that gonna look like?
That was the question. Are you still in charge of the budget? That wasn't communicated. It was a motion and a decision, and there wasn't discussion.
You set the budget.
So we approve all budgets, even elected. But beyond that, we can ask questions during the budget hearing. But as far as compiling the info for the budget,
Yeah,
that goes
I
back to the
understand that.
director.
It's important to us to understand.
Absolutely.
We are a part of this puzzle We're a big part of it. Atchison County is made up of a bulk of your county residents are within the city. It's the operation, the plans, that there are plans for joint communication is, we have a vested interest in that as someone that utilizes the service and understanding communication paths and channels of whether it's a budget or operational item. That's important to us to understand that. It's my responsibility to be able to answer those questions for the city commissioners, and I felt it was important to try to come make sure that we were clear on that and that we can move forward, and we will continue to participate as the advisory committee is developed, and we hope to be a part of that. We want to be. I think it's important that all agencies are represented in needs, and each one has some probably individual and specific needs depending on what they're serving.
Yes, ma'am.
That was the purpose, and I want to be clear, the purpose of me being here was not, as Commissioner Rivas suggested, to imply that the sheriff is going to wreck the Joint Communications Center. That's not why I'm here, and that's not how I represent the city, and I just want to make clear that that's not what my intention was, but we did need to have some things answered. I do think we'll have some additional logistical questions, but I'm not the one that can intelligently ask those, so I've asked our chiefs to put that together, and then we'll forward those on to Sheriff Lori.
Sure. Yes, ma'am. And another thing that I wanted to, just historically, we had 5 city commissioners, 3 county commissioners, a board, and a director. And to your point of having a plan, I don't think we've ever had a plan since I've sat in the commissioner seat. There could have been a plan that we think we have, but like when it came down to the county commissioners declining a wage increase, could the director have went back and it's in her budget, done it anyway? Probably, but again, we're funneling under whatever channel feels right that day.
Right.
I mean, to be honest with you, like, and so
we look
I see
forward
what
to
you're
having
saying.
this settled and knowing specifically how these things are going to work. The logistical questions, I'm not the one to ask, but I have asked them to put those together if they have some. One was, is Kim still the contact for certain things, and I don't remember what those were, but we're compiling those and we'll get them sent on. But it did feel a little bit uncomfortable to, sometimes it feels like a decision is made and we are required to reverse engineer how we're going to respond to that, which is fine, and we're going to do that. We want our citizens served by Joint Communications as much as anyone in the county, but it is more comfortable when you feel like you know what is happening and what your expectations are.
I completely see what you're saying, and I think more of this feels good, because at the end of the day, when we don't have this, it's our citizens that ultimately are paying the price.
Right.
And that's never okay.
Operationally, it's not okay when, I think, it's not just us either at our levels, but people beneath us have to know how to navigate the system that they're working within.
Yes, ma'am.
That's important for relationships, it's important for morale, and it is important for the safety and how people are operating within that dichotomy. It's important that I have information that I can share with them so that they know who to go to and what path and what to expect when they pick up that phone. And that's important, that it's not just the fears that I have that might be about the budget, but that we are able to make sure our staff and maybe even some of the rural agencies understand well enough that it's going to be the same, this is what we can expect. We need all levels to be comfortable to continue offering the best service to our community. So, thank you for letting us come today and ask. And I know we'll have some additional logistical questions, and we'll get a list together and work on those.
And as far as the equipment, after our last meeting when we talked about encompassing all of it, I know Kim was putting together a list of that.
I think she put, I'm not sure what feedback we've provided her, but I know Chief Wilson and Chief Weiser had both reviewed some lists that had the radios and things like that on it, so I can follow up with them and see if they ever returned that to her.
So to answer the question about the budget, because this has been different perspectives moving, like historically, one commissioner didn't think batteries, one thought, how do you guys foresee Kim putting together that list so that we can ensure everything's accounted for? Because for me, I'm like Bob Campbell, like, what's the use of a radio without a battery? Like,
no, I don't think the battery was necessarily, it was including it as
batteries were an issue for.
capital improvement, it was whatever category it was.
Yeah.
We purchased the batteries out of joint communications.
It's a capital expense, it should have been more of a supply.
Yeah.
I think is what it was, yeah.
Consumable or something.
Consumable, whatever it's called, yeah.
There was more questions like, how far do we get away, clear down to rural fire departments? How much are we purchasing for them? You know, a computer, multiple computers, you know, and that becomes kind of a gray area, and that's been questions in the past. So I don't know if that's ever been absolutely set. I mean,
Yeah, that would be nice, puts this group together, all the users, they can sit down and kind of really kind of talk that through and see what's reasonable.
Determine what they feel is joint communications related.
Yeah, I would be
Yeah,
real
equipment.
mindful of that sales tax money being used for its intended use.
Yeah.
And so, and with that, within that constraint, whatever that budget is and cash flow looks like, makes a big difference too. I mean,
yeah, and replacement intervals, things like that. I think we'd probably rely heavily on our IT to give us recommendations on life
Right.
computers,
Like how long a battery or a radio
Yeah.
lasts and all that, yeah.
things like
Okay.
that.
Yeah.
Okay.
I just don't think we should get into nitpicking any of that, because like if you're the head of rural fire department telling me you need something for the job, who am I as a county commissioner to say like no? I mean, you're the person putting your life on the line. If you need this piece for joint communications, you know, it's a yes. But again, we're far removed from.
So for right now, things like, I think we might have had a battery replacement or one coming up. That can just be sent to Kim like in the past.
Yeah.
right.
Okay, that's helpful. That was one of the questions that had come up. I don't know if it was ordered or if he needs to order one, but how does that look? Is it the same point of contact? And then we'll get the rest of our logistical questions that I'm not experienced enough to ask and get them to Sheriff Lori, and then kind of start sorting through some of that. Well, thank you
No,
for
thank
having
you,
us. I hope
guys.
you all have a wonderful long weekend.
Have you met Debbie?
Yes. Yes, we met. Oh, Deb. Oh, I'm sorry. I thought you said Amy. I misunderstood.
Hi,
Nice
I'm
to meet
Debbie
you.
Ball. Nice to meet you.
Eric.
Welcome to the city.
Thank you.
Thank you for having us.
Yeah.
Good luck with the rest of your meeting.
I know. Hey, one off-topic thing. Gary County they do quarterly meetings with their city, just like this, and their school district.
Ottawa does too.
How do you feel about that? I loved the idea.
I think it's a good idea. I mean, Ottawa does one monthly with city commission, county commission, school district, so all of the taxing jurisdictions essentially.
Okay.
Just to update each other on
Yeah.
projects going on, or if there's any partnership
Yep.
that could be happening. But maybe they do them quarterly. I think Ottawa does them quarterly as well, so,
Yeah, I saw, she posted their agenda and it was like the city, the county, and the school district, and I'm like, that is a great idea, and she was like, they do it quarterly.
like a lunch? Ottawa did theirs as a lunch meeting, but I don't know is that what they had too?
I'm not sure on the
Maybe look
lunch,
at that
but
and we can
yeah,
compare
I
some
think it would
notes.
be helpful though.
Yeah. I would be willing to float that idea. Look and see if you would when they scheduled theirs.
Yep.
And that might be a discussion on a schedule that works for everyone, but,
Yeah,
okay.
okay, awesome,
All right, well, thank you again.
thanks.
Nice to see you. Nice to meet you.
Thank
Nice
you.
to meet you.
Always all right.
Okay, your, okay. We are just right in line here, so, Atchison Senior Village, interim administrator, David Mercier.
Hello.
How are you?
Okay, how are you guys doing?
Good. Last time we saw you, did we make it through your daughter's wedding?
Yes, I did. Made it through
Was it
my
good?
daughter's wedding. It was real good.
Awesome.
She organized it very well. Had stuff for kids and teenagers and adults.
Nice. Well, welcome back. We're happy that you can join us to visit about the federal F-837.
No, it's, I didn't know if you wanted an update on everything else on where I am.
Sure, yeah, that would be
Where
great.
Lindsay is too. Kind of start out with that, I guess. Lindsay, the AIT and that, she's, I think, coming along really well. She's really stepping in there and getting involved with everything. The staff's responding well to her and that. And She is ready to take her state test. She'll be taking that on Thursday.
That's been pretty quick.
Yeah, once she takes her state test, she can apply, she can apply and get a temporary license. So she can, and from what I understand, these results come back the same day, so she can do that as early as Friday, which what that would do is she would become the administrator of record at that point. I would stay on as a preceptor and consultant because she still needs to finish her program, her 480 hours to be eligible to sit for the federal test. So it'll still be several weeks before she would be able to sit for the federal test. So I'd stay on, come up maybe once a week at that point, but then it would drop. Right now, the charge for my license being on the wall per week will drop. It would just be a payment just for me coming up for the day. Just helping her out as a preceptor and consultant, whatever questions she has or anything like that. And if something were to come up that I need to come up for more days than that, I would be available to be able to make arrangements for that. Although I do have a commitment starting June 16th that will only last about a month and a half. After that, I can come back. Right now, I don't have anything scheduled after that. So that's kind of where we're at with that. And just, I brought up some of the information, I don't know if you guys got the copy of Federal Tag 837. That's, I brought some copies of it that, just discussions with, K.S.A. here and that.
Thank you.
And just the expressed interest, the idea of getting the facility back to kind of where the commissioners aren't as involved with the facility as has been before. It dawned on me that I don't know if you've ever reviewed F837, which is the governing body, which is you guys. You guys fall under this tag as the governing body. It's kind of more important now than it has been in the past. This tag has been there for the 40 years that I've been in the profession, but they haven't really done anything with this tag for years and years up until the last several years, mainly because we've had some outside companies come in and buy chains of homes and just run them into the ground. The one I think that triggered it the most was an organization out of New York, a Jet something or other, came in, bought several facilities here in Kansas, didn't pay their bills, things on that line. But we've had other organizations as well. And it's happening in a lot of different states, not only Kansas and that. So CMS has taken the position that instead of just looking at what's happening within the facilities, they're looking at who owns the facilities and holding them more responsible of what's happening. So they're looking at enforcing this F837 more than they have in the past. I don't think it'll impact you guys as much because you're a county home, and that they're not looking at just a single facility. You're not a chain. You're not from out of state. You're government owned, things along that line. But because they're looking at this overall, everybody gets kind of caught up in this. But just I didn't know if you understood the structure and how the state and federal government looks at the structure of the facility and you guys as the governing body. The question, I think the facility is coming along really well. I think Lindsay is selling in really well, and Ashley is, I've talked about Ashley before. Ashley is in the process of getting her RN, looking at her moving into the director of nurses position. There's been the question of whether you guys should keep the facility or not. I can't definitively tell you one way or another. That's the kind of decision you guys got to make. But I feel the facility is moving very strongly to where it will. It may not get back to the point you guys have expressed in the past. The lady that ran it before, you guys got very little information or very little involvement with the facility. I think from here forward you will have some involvement with the facility, but I think it's getting positioned to where it'll be a very well run facility. I think it'll have good management. I think there's a lot of support by the community, a lot of support by you guys. And I think that it'll get to the point where it'll be a well-run facility. But I guess the cons, if you want to call them that, is that long-term care is getting to be it's always been kind of a political football, and it's getting that way more and more as things go along. I would suspect there's going to be more, it may not be a pandemic, but it seems like whatever political party is in power, and something comes along that's going to affect the elderly, nursing homes are targeted, and a lot of pressure is put on the nursing home profession. I think that's going to continue in the future, and that's where there'll be some involvement with on the commission level with the facilities, and it being a county home and the communities, how much the community wants to keep the service for the community has to be weighed in. That's you guys would know that and be able to judge that. But that does weigh in any decision whether they have to keep it or sell it. And that if you were to sell it, that it's going to be run very differently, and more than likely a corporation is going to buy it. It's going to be run very different than it is now. Be good or bad. There's a lot of resources when you're in a corporate structure, but there's also a lot of things that take you away from a lot of care that I see the flexibility with the structure of the county system, that there's a lot of I think a lot more flexibility in spending a lot more time with care than in some corporate structures. But your question, I just want to come and kind of clarify this F-837 that you guys have always had and will, and probably in the future. The survey system and that will probably look at the ownership structure of the facility more than they have in the past. Maybe questions that come up or issues that come up will rise to the county level. Any questions?
So how do we know what is a sufficient reporting to avoid the tag? I mean, or is there like a list of, you've got to spend so much time, or is there a checklist or things?
There's not really a checklist. What they're looking for is that, as it says in the FTAG here, that you guys are responsible to make sure that we've got a QAPI system, that the administrator, you guys are responsible for hiring and firing the administrator, that the administrator is reporting to you guys what the issues with the facility are. Things are running, that the things that are being pointed out with the survey system, if we have any issues in that it is going through the QAPI system. They're putting a lot of emphasis on, and that's quality improvement, system is what they're looking for, is that if you identify an issue, is that you sit down as a facility and you write out what your objective is to get it corrected, and what the steps are, and that you're following that and you're getting that issue corrected, and that you guys as the governing body are aware of that we have that process in place, which we do, and that's getting reported to you, that system is in place, and that we're addressing issues that we're having. So that's the biggest thing, is that they'll look at that you guys are being informed, that you guys are making decisions that are best for the facility to take care of what's happening, so we can run it correctly.
I have a question on that. So rewind 2.5 years ago, I wasn't sworn in yet, but I got to sit on the interview panel for the admin, and we had talked about having a board put together, like an advisory board, and the answer was, oh, you don't need those, we have the QAPI meetings. And so I started attending the QAPI meetings, but those were more drilled down to like patient care of who, kind of private information and things that the nursing staff and all of those folks.
Yes, most time it is. Yeah.
Okay, so my question is, since then, now that we have an advisory board, as the commissioner over Senior Village, I go to the advisory board meetings, but not the QAPI. Do I need to be part of the QAPI to stay in compliance? Because
It's not a requirement for you to be. at the
Okay,
QAPI,
perfect.
But like I say, it should be reported to you.
Okay,
that, you know, that
so like
they're
a-
being carried out. You know, they don't have to review the entire thing, the entire agenda that was covered.
Right,
But
but-
just a synopsis of what's, you know, what's going on,
Okay.
the major issues.
Okay, so we'll ask
You know,
for that, 'cause-
yeah, one of the biggest things, especially clinically wise, we go over the quality indicators,
Yep.
which is, you know, what falls are we having, what skin issues are we having, what weight loss are we having, you know, just the basic care things that jump out, that if someone is, you know, that if the facility isn't giving good care, those numbers start climbing, and that's not a good thing, so.
We had the director come do a quarterly report to us, or some quarterly report, kind of summary of budget-wise, quality improvement issues, whatever.
Copies.
Things like that, with that.
Yes, that would suffice.
Okay.
Yeah, that's what they're looking for.
Rather than drag her in every time, you see a written report or.
Yeah. No, they're,
So in the facilities that you've been involved with that operate under a board type structure, is the board involved with any of the decision-making in QAPI, or they just set up, here's a system and go do it? Because the
Yeah.
regulation appears to say they're responsible for the
Yeah.
QAPI program.
That's-
And
Well-
that makes me think that they should be reviewing.
yeah, that hasn't been, the way it's been carried out and looked at, you know, they're not responsible for making the decisions at the QAPI meeting or anything like that. They're responsible for making sure that the QAPI system is in place and that's being followed.
That's how it's been interpreted in your
Yes.
experience, okay.
Yes.
And is QAPI, is that required every month or every quarter?
It's required every quarter, but most facilities, including ours, we have a QAPI meeting every month.
So it seems like we ought to have a checklist of hours where we are checking off to make sure that it's done. And I don't know how we,
So I'm
Well,
on,
you could have the QAPI minutes being turned into you on, you know, because you make a report, you have to keep track of the QAPI. There's a form that we fill out on what, the different topics, each department has different topics under it, and it has what calls a PIP. It's a plan of correction of, something that they're working on. And, yeah, just have that turned into you, that way you know that it's, and it has a starting time and all that stuff.
does that have individual patient names?
No.
And information? It does
No.
not have that in
No.
there? Okay. All right.
It's HIPAA safe.
well, and
Yeah.
I'm on all the invites for the monthly meetings, and historically, the previous admins have had patient info on some of that documentation, so.
Well, like the backup reports may, you know, because
Yeah.
they run reports, you know,
Yeah.
that how many falls have you had? And it does, you know, the PCC, which is our documentation system, and that does spit out a list, and
Yeah.
it does tell, it gives the nurses, you know, the documentation, what's been recorded and who's fallen, when it was, and all that stuff, and that's what they need to do to make their decision. So that is follow-up information, but the actual report, you usually do not put resident names and stuff in it.
And I know they have the sign-in sheet and the medical director's there,
Yes.
because he was usually the one deferred
Correct.
to of like, hey, what do we do? Because
Yeah.
as a
medical
commissioner,
director,
yeah.
and like I say, they're only required to be there, you know, and only required to hold it once a quarter, but that, we do it every month, and the medical director is usually there. At least it makes it at least once a quarter, and more often than that in most cases, so. So, yeah, I just, with all the talk of, you know, this, I wasn't sure how familiar you were with this tag.
How can we drive revenue? You know, we've got the reimbursement rate. Is there anything we can do to improve that? I mean, what?
Well, now that Lindsay is there and getting a system, I've been talking to them, they need to get out and do some marketing. The biggest thing that's gonna drive the revenue is your skilled census.
Like the
Okay,
bariatric beds and the.
Yeah, the Med-A and the third-party insurances have the biggest reimbursement, and that's where the biggest margin is. Your Medicaid, although Medicaid in Kansas is getting a lot better, they're in the new system, I won't get into it here, but they just passed some revenue reimbursement to the nursing homes that will that will increase our Medicaid rate. But historically, Medicaid rates have been less than what it takes for you to take care of a resident. Private rates are a little bit over. It kind of washes out some of the stuff that, some of the loss from the Medicaid system and that. And the really real margin in our profession is Medicare and the insurances. So that's one thing I've been talking with them there, is that we need to concentrate on. And it's good to have the overall census up, but that the skilled census is where we really need to concentrate on. And from what I can tell and see, or what I've seen, that is that there really hasn't been a push or a marketing system in place to really work with the hospitals and the referral sources to get us more skilled census. And I think that's where they need to concentrate on. And like I say, I think a real good team is being developed, and I think a relationship with the hospital is getting a lot stronger. And so I see an upturn in that type of a thing.
So do we need a person that's dedicated to that kind of as a salesperson, or is it something?
I wouldn't
that
say so, and
does?
yeah, just be, if you had different people sitting in this chair, they'd probably tell you different things. But in my experience, especially in a smaller community and like in the county home and that, I think Lindsay, Ashley, the management team, the hospitals want to see the people that are actually the ones making the decision. They get people, marketing people all the time, and they're just bringing in propaganda, and they'll say what, their impression is. They'll say whatever they need to say, to strengthen the relationship, which is fine. But when you get the administrator in there, the director of nurses in there, and that they see and know the individuals that are actually running the facility, that are actually making the decisions, it's a much stronger relationship, and they're much more comfortable in making referrals to that facility, because they know the individuals and can pick up the phone or whatever the case may be and contact them directly if some question or issue comes up. That makes them much more comfortable to make a referral to the facility. So I'm not a big advocate of a large marketing system, and that I think the facilities need to get, like I said, get out there and have the people that are actually involved with running the facility out there doing the marketing. That's my 2 cents.
One of the things I'd like to see is, and we're kind of working on it as we walk through the budget process, is I know you worked on the 2024 budget, and some of the items, so we're trying to separate and extrapolate the ad valorem budgets of our general budget and pull out the senior village costs, which I know you were working on, like a contract for legal, but like HR, IT, maintenance, the financial director, some of those costs for services, we're trying to extrapolate what the cost for senior village is, so that we know, and that we can make sure that we're producing revenue to cover those costs. So just wanted to let you know that as you work through the budget with Lindsay, to kind of account for some of those costs so it's not ad valorem tax dollars paying for senior village, because so many of the services that being county owned that we're using come out of our, and aren't accounted for. So I think that's helpful for me, especially, we're looking at numbers as we sign weekly reports, and it's concerning to me. So just knowing, I know Lindsay's new and that wasn't the strong suit, so having you there to be able to help us with some of those identifiers and to make sure we have them in the budget so that they're accounted for.
Go back through that stuff.
Perfect.
Okay.
Yeah.
And David, my understanding is that would be a benefit, and no matter what the dollar figure, let's just say, for example, accounts payable, if we said that's a $5,000 item for the year, we're not currently including that in the cost report, so it's not getting captured, we're not getting any reimbursement for it. But if we were to say, put whatever value on it, say it's $5,000 for that service, even if we're not asking you to write a check back to us, it can still be carried on your cost report, and something that should be a benefit to the facility. Am I understanding that correctly? Because I'm seeing a puzzled look on your face,
Yeah.
maybe I'm not.
Yeah, I'm not quite sure what you're asking here, that if you,
Well, there are some services that the county provides that, and we don't ask for checks. HR,
All the county.
any work that I do,
Maintenance.
IT, you know, all of these things. I don't know that those have some cost in there. I don't think they're reflected on a cost report because we haven't really identified what they are, the dollar figures on them. And I think the fear that we've kind of run into when we've discussed it with administrators is, oh my gosh, you're gonna ask me to write a check to the county. And which isn't really what we're trying to get at. I think what we're really trying to get at is to make sure that those services are recognized so that they can be included in your cost report so that it would be more accurate.
Yeah, okay, I understand what you, yeah, I think you could, if you could come up, you know, with a dollar amount of what those services represent, you know, a certain percent of time or whatever it is, by whatever the payroll costs are and then anything else, that, yeah, I think that would, you know, definitely be eligible to be put into the cost report.
And I think year one doing that, it's gonna be a little bit of swag in some areas, but then those departments can monitor things for the next year, have a more accurate number next year, hopefully.
Right, because that would be similar to a lot of the, you know, when you're corporate owned or whatever, and that they put in a management fee, okay, and that's what would cover those things, that they have the central office or whatever, in this case, the county, is covering, you know, doing the billing, doing HR or whatever those are, and there's a cost to the facility that they do incorporate into the cost report, so he doesn't.
What's a typical management fee percentage-wise? Any idea of range?
Oh, I can find that out off the top of my head. I
That'd be
don't remember. Yeah, yeah, it's a percent of census. I'll track that down for you.
You know, like, come back and say it's 15%, but our people have added it all up, and it comes to 25%, we're probably not right. So it gives us an idea, give us a range.
I'll get
Might
that
be
to
helpful.
you. Okay.
I have one other question for clarification. That example you had mentioned about the New York company buying several Kansas homes and then running them into the ground. Because in conversations I've heard, like, that was the trend of Kansas homes closing. But is it because of that scenario? Not necessarily just Kansas homes aren't sustainable anymore. It was that New York company, or do you know?
Well,
like,
there's several different questions, and not every company coming from out of state. I don't want to give you the impression that every company coming in from out of state is a bad company.
Right.
There's a lot of good companies coming in too, but there's also, like I say, there's enough to where it rose to the level of CMS being concerned of what's going on in the country of these companies coming in and doing that.
Gotcha.
But yeah, I'd say there's a lot of different issues, you know, just the, you know, anywhere from labor costs to, you know, increases in supply demand, and and some of it is you know, ownership and that. And just the other options that you have besides nursing homes, you know, they're really pushing the home health and things on that line, the lower the assisted living, the residential homes, things on that line to go into a lower level, which is fine. That's no problem, but it is impacting the nursing homes. A lot of, especially in smaller communities, there's not a census high enough to maintain the facilities. That's why a lot of them are closed.
Do you have any pointers, because I know your history in the facilities and in the industry, as 3 county commissioners that are detached from the facility without a medical long-term care background, things we should be asking at these meetings, looking at, I mean, that I like to be proactive, and I want to make sure that we're engaging in discussions of what the future sees.
Yeah, your level, probably a good thing, you know, is, you know, obviously the state survey reports, things on that line. Financials, that it's financially, you know, it's financially running soundly. One thing that you can ask for is what's called the K.S.A report. What that does, it comes out quarterly, and that breaks down the facilities, what they call the quality indicators, the thing that's happening with the facility, and it reports, it gauges what's happening in our facility. It's kind of hard to understand. We have to send in information to the government on a regular basis. All right, and I won't get into what that's all called, but they generate this report, and they take all that, what our numbers are, and it gauges it against what the state, the state average is and what the federal average is. And they put that in this report, so you can see, are you doing better or worse than what the average numbers are.
So
in
who
our
puts that
profession.
report out? Is that CMS?
CMS puts that out. So yeah, and the facility gets that on a quarterly basis, I believe. But you can take a look at that, and it's pretty easy to read, because you can see the percentage over there, and they even star the ones where you're kind of out of whack. And that is, like I say, that's where we use some of that we use that report to structure our coffee projects and that okay, we're out of whack here. What do we need to do to get back into, get our numbers up or down, whatever the case may be. That's what direction we need to go.
Okay.
That would give you a good idea of what's going on in the facility.
Perfect. Yeah, thanks. I haven't heard of the K.S.A report yet, so it's good to know.
Yeah, I've seen like a referenced once before, but
It doesn't look like very light reading to me looking at it here.
You pulled it up. So we'll let you give us a summary.
Just a list of quality measures. I'm going, really?
No, when you, and I can pull our last one or whatever and then get that to you guys. It is very, it's not long, but it is several, and give you a crash course. Like I say, it is fairly straightforward once you see it on paper, because the numbers are the numbers. It tells you, it compares, like I say, it compares it to the state and federal, and it's all right there on the same line. You look across what, say like it falls with incidents. That means if you have a fall and somebody's injured, falls with incidents, and it will say your percent is this. And that is one thing that is difficult, because having a smaller facility, you have one fall, your percentage jumps up. So so you got to kind of take that into consideration as well. Is that if you've got a 100-bed home and you have several falls, and your percentage still might be lower than you might have 1 or 2 falls in a smaller facility. So you have to kind of read those things, what you're looking at.
so having a facility that's nonprofit, does that change the tenor of the administration? A
lot of people say that it does, but in my profession, I've run for-profit and non-for-profit, and
I haven't seen that, but I've wondered that before.
Even
It's like
not-for-profit organizations, there has to be that margin. They're looking for that margin, and it kind of depends on the philosophy of the non-for-profit. A lot of them, supposedly that money goes back into the facility. Well, a lot of non-for-profits, they own several facilities, or they own an organization where a lot of that money does not go back into the facility. It usually goes into other projects or into supporting other things that they have going on in their organization. So I'm not, it's been my experience is that there's not a lot of difference between profit and non-for-profit, although the survey system, they do look at non-for-profit a little, and that's another advantage here, is that they look at these non-for-profit a little easier than they do for-profit facilities. Because the way they look at for-profit is that you've got this structure up here, and you've got this guy driving a Cadillac here at the top, and all this done, and has a summer home and all that, that a lot of it's being pulled out to do that type of stuff. But even the non-for-profits, their CEOs are making several $100,000 a year and driving Cadillacs as well. It just doesn't get talked about as much. That's been my experience.
there's got to be profit, or they'd never be able to keep them open. But it's just the way it's dealt with. It's not going to a corporate.
Yeah, people don't like to talk about it, but it is a business, and that it has to, like any business, there has to be in the
maintenance and bills and everything they have to be addressed.
Right, there has to be some kind of a margin to keep the doors open.
Sure.
Okay, thank you.
Thank you very much.
Thank you.
Okay, Joe Snyder, Road and Bridge Superintendent, approval of grading and ditch stabilization bid, and a department update.
Real quick, we had a scheduling issue with Michelle because we thought we were on your schedule today. So we're gonna reschedule with her at some point. So I don't know why you you to just think we come and hung out real quick and
Okay.
then leave now. So, because we thought we were on the schedule for 11, and I thought you were just running behind, but we can come back, so we'll try to get on next week.
Okay, sorry about that.
Well, I'm sorry. I just wanted to say something. Sorry, John.
Sure.
No,
I
that's
didn't want you to
fine.
think we come and hung
It's
out for an
courtesy.
hour and left. So,
I think you could be on, I mean, you could add a public comment if you wanted to, or you could come back.
what time would your public comment be?
In about an hour.
At 1? Yeah, we could do that. That might be, is that okay?
Yeah,
I didn't wanna-
absolutely. Sorry, yeah.
No, I just didn't want to interrupt your, yeah.
I-
Okay, okay, we'll come back in an hour.
Okay.
Is
Okay.
that okay?
Yep.
Okay.
All right.
Thank you.
And give or take, it might be, like, that's rough, but we have one executive session that might be 5 or 10 minutes over, so.
Okay.
But one is a good standing point, because we're running ahead, so should be good.
Not a problem.
Okay.
Okay, we'll come back.
All right, thank you.
Sorry about that.
No, that's okay. Thanks for fitting us in.
Okay, sorry, Joe Snyder.
All right, last week we opened 4 bids, and I'll just go ahead and repeat those for the grading and ditch stabilization improvements on 310th Road, north of Muskota. Ruby Construction, the highest bid of $328,542. Lexco, was $284,846. Aller Construction was $244,973.32. And King's Construction was the lowest bid at $215,000. As per MHS, who helped us through this project, I've got a letter from Matt Henderson stating that we have reviewed the 4 bids that were publicly read in the county commission meeting, May 23rd, 2023, for 310th road grading and stabilization improvements. King's Construction was the lowest qualified bidder and recommend that you award them the contract. And I'm under the same agreement, that I think they are the lowest qualified bidder and should be considered.
Okay. For a motion to approve King's Construction for the grading and ditch stabilization bid for $215,000. Do I have a motion to approve?
So move.
Second.
It's been moved and seconded. All those in favor say aye. Aye.
Aye.
There is
Passes
the
3-0.
notice to award with the dates that I believe you need to sign the back, the top sheet. So, did you print it? I don't know. But I did.
What's in your folder?
I don't remember if I put it in.
No.
No, okay.
And then it has the dates on it, 10 days and what they're supposed to do, and then the contract, which I'll talk to Pat about all that here after the meeting.
Is that for all of us?
Okay. Heart.
No, it's just for,
That's not I just want to make sure it wasn't.
yeah. We'll move forward with that. Now, anybody have any discussion, any questions about that? If not, I have a few things while everybody's here. Have we figured out the loan for the truck from the First Option Bank?
I haven't heard back from Michelle.
Is she on? Is Michelle on today?
I'm
You're
gonna show,
Michelle,
I'm gonna
okay.
show on it.
And then the other was, I've talked to Kaylee, and she's gonna look into getting insurance on the tractor we leased, it's here. And then the other thing was the rod belt payment for the right of way. We've done everything, but we haven't paid that. So that needs to be taken care of. I think that goes through Michelle. Michelle's
I think we
office.
just need a purchase order for the rod belt payment.
Okay.
We had the framework for.
Yeah, everything's done. I didn't know if that, usually does that go through Michelle or does that? Yes.
It does now, right?
So, but the PO is small enough now, I guess, get that to Michelle then. All right. If you want to,
You guys get that?
I don't know, I was assigning the amount and everything, but I can create a PO.
I don't have my computer, so. And the other, I can do an update when we're doing that. We'd had some concerns on trees on 2 bridges on Rollins Road, south of 262nd. This weekend, those trees were trimmed. I had Jimmy Ellis come in and trim them. They didn't need it. So if anybody says anything about that,
Thank you.
we did do that this weekend. Kansas Gas is working on 278th between Rollins and that'd be the city limits. So if you have a complaint about them, they're gonna have the road closed for 2 or 3 days. We are working on they've got one side almost done on 242nd, and they're working on the other side. Hopefully by middle of next week, we're done with that project and with the other road open. But I don't think, unless somebody else has anything for me.
Joe, I just got that alert. It says 278th Road from John Street to Rollins Road.
Yeah. Yeah. Anybody have any?
Nope, we just have a attorney-client
Yes.
executive session,
Executive session.
which we're running ahead of time, so we can just do it.
It's however you guys want to
Let's
do it.
just do it. That way we stay on time for Rainbow if they come back.
Now,
Yeah, let's just do 15 minutes.
15 on that?
Yep.
No big deal.
I just shrink it down a little bit.
Yeah.
I think he went to. I think
Yeah, he
Brandon
went to,
was
yep,
talking.
he'll be right back.
I will move that the Board of County Commissioners recess into executive session at 12:02 p.m. for consultation with an attorney for the public body which would be deemed privileged in the attorney-client relationship as allowed by K.S.A. 75-4319B2, and that the purpose of the closed session is to protect the confidentiality of the discussion, and that the board come out of executive session at 12:17 p.m. in the EOC 10443 US Highway 59, and those present will be Joe Snyder, Road and Bridge, Mark Seltner, 3 commissioners, and County Councilor Pat Henderson.
Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Aye. Passes 3-0. Go into executive session. In 10 minutes.
I'll make a motion that we extend our executive session for 10 minutes. Same criteria.
Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Aye. Passes 3-0. Going back in for 10 minutes. Yes, sir.
Just say, well, no, because you're not going into a closed session.
Just,
Okay.
okay, so we should be fine. Okay, perfect. All right.
So are you gonna need me to be around here, or are you done with me? Makes no difference, you just tell me.
I think we're probably good where we
Yeah,
need to be.
unless you want to come back later. What's your call?
Um,
Thank you.
Hi, thank you for the delay. So Corey Scott, Emergency Medical Services Director, and Patrick Henderson, County Counselor, with the opioid expenditure resolution.
The Life Pack 15 has already been delivered. The final PO at a previous meeting is already in service. So the resolution passed to transfer the opioid settlement money to reimburse EMS ambulance. The ambulance equipment fund.
I had drafted a resolution that was circulated, and Mark and I had, our figures were wrong, and didn't agree on the amounts of the settlements, and I have those listed in the resolution, and I just noticed that, so I did double check to see if we're agreeing. I didn't have the Walgreens one in there.
If
you guys need a little time,
Is Mark part of your, he'd be part
no,
of your?
not the, well, we have an executive session with just the
Oh.
commission and HR for 15 minutes. So that might be a good time for you guys to get your heads together and we can keep moving.
The number on the first.
Okay.
Correct.
Jody, are you joining us via Zoom? Because I know we're ahead of schedule, so I just wanted to make sure you're okay with that.
She's driving here, man.
She is headed out there. Okay, so we'll wait for that, but we can still. Is Wes on there?
Wes is on.
Wes is down, we're down the bottom.
He's coming.
Okay, perfect. We'll just bump Wes into this position to let them get their numbers in order.
Wes just sent us an email.
Sorry, I'm reading it.
Oh.
Good afternoon.
Oh, that's for next week. We just got your email.
But
Oh, it's next week.
Yeah, I was like, oh gosh.
That's next week.
Thanks for letting us kind of manipulate today's agenda so we can keep moving.
Not a problem.
Okay, so Mark reached out about the City of Effingham agreement between the county commission and the city commission, and said you might want to terminate that. So he told me to get on the agenda, so I sent you guys the agreement, and here.
Perfect. Yeah, I just think when we were talking for 2024, if we do that, like, it's nice to have everybody have ample notice of what that looks like. I think it sounded good at the initiation of it, but getting back to basics of where we're at, it's probably a good plan to not renew for 2024, in my opinion, after discussion with financial director and.
So is it saving money by terminating, or what?
Well, the feedback constituents have given me is just like, we're not really in the IT business to provide services for others, like, and at the K.S.A, there's a lot of counties that have done things, but it's like getting back to basics of like focusing on just county business and not, so.
So it's doing business, or doing it at all, it's not the price.
Correct.
It doesn't matter to me either way.
No, yeah. I know it doesn't, you're like,
Either way, it
I'm
does not
just
matter.
here.
I mean, they're very minimal.
Yeah.
The amount of work that we actually do for them. And then they reimburse us for our time.
Well, and that has been one of the things we've learned is like the reimbursement piece and the revenues don't come into like when you're talking budgets, which has been a learning experience and good, because it's like when we budget for things, the revenues aren't shown, which I really wish they would be, but.
Well, there's only certain departments that have revenues, so, and that's the only one. The IT department has
Yep.
$1,080 a
Yeah.
year for that, so. So then you're gonna draft up something to send to them?
Yeah, how because he created this, right?
Yep,
Yeah.
and it says here in writing, you know, so he would need to draft something, you guys would need to sign it, send it to them, they would sign it.
Okay. And that would be still with Mr. I read an article, he's not running, so.
He's not rerunning, but
He's not
he's still
rerunning.
current.
He's
Okay,
still-
so it would
he's
still
still
be with him, so it should be fine, okay.
Until, he'll be there until January, right?
January 1st, I believe.
Okay.
For the first Monday in
It'd be the
January.
first Monday, I
Yeah.
Oh,
think.
yeah.
Like that second week,
Yep.
January
Gotcha.
1st,
when everyone takes office.
Monday.
Yep.
Yeah.
Yeah, first Monday, first full Monday.
Like the first full week or something.
Yeah.
Like the second, yeah.
January
First
10th.
Monday after the full,
Yeah,
then full week.
whatever the language says.
Wow.
Yeah, no,
They make
that's
things
fine.
complicated.
Right away, but
Okay.
it'd be the 8th.
Okay. That's all I have, unless you have something else.
Not.
Okay.
Thank you.
Have a great rest of your day.
You too. Okay. Okay, so that one. Oh, actually, there's a couple purchase orders. So
So I have a purchase order, looking for approval from Road and Bridge, to Norma J. Rodbelt trustee, for the right-of-way easement related to the reclamation project adjacent to Bridge 310 on 314th Road between US Highway 159 and Chase Road in the amount of $4,574.82. Okay.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
Aye. Passes 3-0. Okay, go.
I didn't have the wall, so that number is, that's fine. That's the right number, but I have a dollar sign and then a space and a dollar sign. We can print that after it's free.
Yep. And do you have a resolution number you guys want me to put on this one?
1524.
Yes, that's what I got, 1524.
Okay, so I would look for a motion to approve a resolution number 2023-1524, a resolution of the Board of County Commissioners of Atchison County, Kansas, approving the expenditure of proceeds of opioid litigation settlement funds for the purchase of a heart monitor for Atchison County Emergency Management Services.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
Aye. Passes 3-0. And this, can you remind me on, I know, is this the heart monitor utilizing all of that, that's been received?
It is not,
I know we did the PO before, oh, there it is, 20,000, okay, so this is authorizing $20,188 of the $26,741.65, sorry. I just thought it would be helpful to say that. Okay.
we have $6,553.65 left.
Okay.
What was decided on the generator for the budget meeting? Remember last week you said, come back and we'll discuss it?
Go.
Courthouse generator.
We're going into a budget workshop here shortly. I'm sorry we don't have answers yet. We're just,
Okay. Sorry, you just told me to come back next week and ask and I forgot.
yep,
So, okay.
thank you.
You asked. There's a holiday in there, Wes. Too much. There's a holiday.
It's all good.
Okay, I have a purchase order from Solid Waste to Tire Service International, for a TC 100 gas tire cutter, in the amount of $28,650. That includes the light kit and the freight to get it here. This was the one that Stacy sent us information about a couple weeks ago. So looking for a motion to approve
Spent out of where?
the $897.
Okay.
I was gonna pull that up real
Yeah,
quick.
no, you're fine. And the purpose of this was when, and I'm pretty sure we were in an open session when she was explaining that the goal of the Effingham monofill, when she's taking into consideration building her plan for a long-term solution for the tires, there's a tire monofill in Effingham that can be utilized on Wednesdays and Saturdays, which Saturdays has been a big need for the public, but the the caveat is that the tires must be quartered or the sidewalls cut out of them so that they don't hold water. And for the average person, that's not feasible to cut the sidewalls out. So this machine would allow them to still take them out there and drop them off like they've been stacking in the tire trailer, and then have the machine, the man that mans the Effingham location would then cut them, put them in the monofill to achieve our goal of filling that first, and then utilizing the trailer for only the larger tires and then the ones with the rims. So we wouldn't be filling up the trailers as quickly, but having a permanent solution like we do at Effingham, just with a resource of helping constituents cut them. So, little reminder of the
Hopefully
point.
this will cut down our costs to do the entire trailer idea. It's,
Yep, I don't think they'll fill up as quick that way, and this is Saturdays already, so it'll just, I think it'll be good.
and there was still quite a volume to fill. That monofill wasn't there.
Yes,
So,
yep,
yeah, so, okay.
okay.
Oh, so moved.
Okay, it's been moved, I have a second. Okay, I will second it. It's been moved and seconded. All those in favor say aye. Aye. Passes, all opposed, same sign?
Aye.
Sorry, passes 2-1. Pat, did you want to talk about these before we did that next executive session, or did you?
Well, those were just requested by bond counsel. I think those are forms for the Secretary of State's office, who has they act as a payment agent for the bonding.
Okay.
And so I think those are just supplemental to the documents you signed last week for the BC Series 2023 bonding.
Okay. Do I have a motion to allow the chair to sign the two documents in reference to the bond with Benedictine College with UMB Bank?
So moved.
Okay. Been moved and seconded. All those in favor say aye.
Aye.
Aye. Passes 3-0. I will sign these, and then we can do the 15 minutes HR and commission, non-elected.
We ready?
Yep.
I'll move that the Board of County Commissioners recess into executive session at 12:42 PM to discuss personnel matters of non-elected personnel as allowed by K.S.A. 75-4319B1, and that the purpose of the closed session is to protect the privacy rights of the employee, and that the board come out of executive session at 12, just say 1 PM in the Commissioner Courthouse. In the EOC 10443 US Highway 59, and those present will be the three commissioners and HR.
Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Aye, passes 3-0. Yes, please.
I'm good. I'm trying to be behaved.
Right. I wanted to do one more attorney-client for 15 minutes, but let's let the rainbow. Are you good with rainbow first? Okay. Yep, good. Yep, thank you.
We can send this digitally too, and I think Julie did, so Michelle's probably got it.
Thanks, Angie.
So, thank you guys, thank you for the, I did a low scale and general comment here, because, we just wanted to kind of give you an update, I'm not sure where to stand, or where to take your spot for you right here. So, just another little packet again, kind of as an update, the latest grant opportunities for the county is coming under what they call the LINK grant that the state just issued the first part of May. It stands for Lasting Infrastructure Network Connectivity. so LINC, Link Grant. You can see kind of, we just kind of gave you a breakdown of how it kind of differs from the CPF last time. But basically, there's 33 million available and it's following under Spark funding. There was extra Spark funding for the state. And so they've established this Link Grant opportunity. Out of the 33 million, about 20 million is going to be for infrastructure, and then they've tagged 5 to 10 million for what they call middle mile structure, which would be if you wanted to link different parts of the state together. So just wanted to come today to kind of explain what this new opportunity is and have a timeline on there. Like I said, it got released towards the 1st of May. The application deadline is June 19th, and then it'll go through public responses and evaluations, and they look to hopefully award it around September. Who qualifies? This one is a little bit different in this situation because they actually identified counties that were economically distressed. And so Atchison actually falls as a county under their criteria for that. And so that was one of the reasons when we get to that next map, we can kind of show you where we're looking. This application will be, Rainbow will be applying for it individually, just as Rainbow Communications. We're actually jointly filing with Donovan County again for their same area that they applied for with the CPF grant. We're gonna basically tee that one back up and reapply. But Rainbow this time is going to actually apply in in Brown County also, and then your area south of Atchison here, we're going to put in a grant request down in that area. Mainly because the opportunity there is we can hook it to the infrastructure. It can bolt on, basically, lack of a better term, to the infrastructure that's already being built in Atchison, but it would be outside of the city limits, and will kind of give us an opportunity to try to do some service around there. I don't have all of the information back yet from our engineers as far as the number of locations and the amount that the grant request will be yet, because we're still in process of working that together. I just wanted to come today and kind of just let you know that will be the area that we're submitting for Atchison County. A couple of the obstacles are going to be, it shows that right now that area shows that there is a fixed wireless provider, Mercury Wireless, in that area. They do advertise that they provide a 150 by 20 speed, and so we're in the process of getting customer support letters from that area. We contacted the Sheriff's Department last week and let him know that we would be doing some door-to-door visits with people that live south of town here, and we're able to get some support letters from residents out there that said they technically can't get that speed. And so how this application goes is if a provider says that they can provide it, we have to prove that they can't. And so the support letters that we're able to get, we'll put in our narrative then in our testimonies with some of the people that live down in that area that they'll let us know they're doing speed tests for us and different opportunities to be able to disqualify what they're saying that they can provide those speeds. Also, most of Kansas, most of the general area in Kansas, especially northeast Kansas, has been awarded what they call RDOF money, and that's several grants back. A few years back, there was a lot of money awarded with RDOF, and this whole area shows that it's been awarded with that too. But about a week and a half to 10 days ago, there was an article that came out that basically the FCC has penalized those companies because they've done nothing yet, and so they've almost disqualified themselves of receiving that money. So there's several obstacles to possibly getting this. It's not just, oh, they're underserved and it's a good candidate, but we still want to stay in front of the state and keep pushing them to recognize Northeast Kansas as a contender for the grant money too. So,
well, part of this area is also Atchison County up here too, right?
Yes, it is actually.
Oh, yeah.
Sorry.
So there's two
Yeah,
locations.
yeah. There's two locations actually, because yeah, everything south of Horton, that's actually where I live. So, well, actually, I'm Rainbow because I'm in Muskota, but yes. So yeah, right when you cross out of Horton, and what we're doing in that area is like filling in the gaps of where like Muskota Exchange goes up to within a couple miles of Horton, and then our Horton services. So what we're doing is try to fill in all those gaps. And so part of that Atchison area out there by Kennecook and the Atchison County Lake and all of that area down 59 before you get to the Y is also in that area too.
Same idea, you just get the system already built in Hortons, you just
Right.
come up with it.
Right. So we put a copy here of like what the support letter says and what we've been offering up to the residents to be able to fill out. We did send Michelle a copy of a support letter for the county, so that would be one request that I would have today. She does have that, so hopefully next week, maybe that can be put on the agenda. We can work with her as far as the county signing off just on a support letter supporting Rainbow in their efforts to apply for the grant.
Can you email me a copy of that?
Absolutely.
Thank you.
So we still have some time. We're not at the last minute type situation, so we'll get that fixed with our whole scheduling misunderstanding here. But we'll have a letter then that you guys can read over, and we ask that if you would be able to sign that for us, just in support of. There's no obligation to the county, just that we've notified you and that you're in support of Rainbow's continued efforts to do that. And then the last piece on here was just I went ahead and left the BEAD funding up because a lot of the work that we're doing right now is to have a lot of the engineering prepared for the BEAD funding. And just to remind you what that is, that's the $42 billion that was set out by the government to fund infrastructure. Right now, the state of Kansas is pulling all the data together to actually make their application to receive the funding. And so they started out thinking they would hopefully get around 200 million. They're hoping to get somewhere around 500 million. So we'll see what actually Kansas is able to qualify for with the application that the Department of Commerce puts in to the NTIA, which is the federal organization. So the BEAD money then will filter down just like any of the rest of the Spark money has, and then the Department of Commerce will manage that. That'll be a pretty good chunk of money that would be designated to broadband for the state of Kansas if we're able to get qualified and get some of the federal money to come down. They're hoping to have that released by the 1st of 2024, and so then there'll hopefully be some more grant opportunities coming with that.
I don't know if you need any assistance, like this area is my district, so if I had, if you have the map where I can help you at all, I mean, I'd be more than happy to put the letter of support out there for people to fill out and send to you. I don't know if, this is just, if there's any way I can help you.
Yeah, no, I appreciate that, and we'll definitely reach out to you. This one, like I said, we're kind of winding down. We did those, we kind of did them last week. We targeted some of the businesses down there, quite a few of the residentials. You don't really need 50, but you need 50 to get 5 good ones, type of thing.
Yeah.
And so we feel like we're sitting in a pretty good place with it. We just obviously we're going to recruit, Dr. Epley and try to get a letter of support from him, and then of course getting some from the county and the city commission on that. So, but we'll just keep coming back and letting you know where we come up, where we just keep pounding away at it, So we just have to stay in front, and it's a little discouraging because we have so many fixed wireless companies that are saying they provide the service and not necessarily maybe doing it. It kind of blocks the grant funding to come in for something that's faster speeds. But on the flip side of that, the Department of Commerce has been very vocal about saying we're going to spread this throughout the whole state. It's not just going to go to a certain part of the state. So when they say that, you kind of think, well, if you don't play, you can't win.
Right.
So we don't want to be discouraged by not, but it does add an extra layer onto it that we have to dispute why we're still making application instead of just making application for underserved. We have to basically have a couple more hurdles to get over to submit the application and even have it be looked at, because some of the rules we're already not compliant with, right? But when we can explain that in the narrative, why we're still making application and just keep after it, we're hoping we can get some attention to it. And the build in Atchison is still progressing nicely and moving along, so things are still going.
Do you need my address?
You're gonna have have some activity up there, so it's gonna get that area of town built faster maybe.
Well, I'm out in
process.
Near this, and I've never heard of Mercury Wireless, so somebody's holding out on us. I'm like,
I've heard the term, but I've never seen a
it's
sign or anything.
frustrating that you have to prove others.
Disprove.
Disprove them.
Yeah. And it's like.
Yeah, so the hope is like, and you'll notice, depending on where the grant funding's coming from, the CPF grant was 100 by 100 and downloaded upload. So that pretty much knocked any other type of provider outside of fiber out. But because this link grant money is coming from Spark, the original guidelines for it took it back to 100 by 20 as the speed requirement instead of the symmetrical 100 by 100. So again, that kind of puts more qualifiers. The CPF grant was 700% oversubscribed as far as applications. So it's such a competitive, and it sounds ridiculous to say only 33 million, but this one is only 33 million, and the maximum grant request can be 5. So, in theory, they could award 6 and be done. 6 and be done. So it's just you just have to keep chipping away at it, and like I said, just keep telling our story and putting it out there and see where we come out. So it's been really exciting. Hopefully Kansas will get a large bucket of that BEAD money, and then hopefully the gates will really open to have some opportunities for the whole county. Okay, well, thank you. Thank you for your time.
Thank you.
And like I said, we'll get with Michelle and I'll email you that letter too. I'll email all of you a copy of the letter so you could have looked at it beforehand, and then we can just have the technicality of hopefully getting that back from you next week.
Yeah, if you send it all of us, that's better than
we'll
we
do
can,
that.
they can review it and we can.
Okay,
Thank you.
sounds good. Thank you.
Thank you. I think 10 minutes is probably fine for executive session. Attorney-client, finance director, county counselor, and commission. Are you okay if I throw this old one away? Then, yep, I'm.
Rip it in half so we don't accidentally use it.
Yep, I.
You said attorney-client?
Yes, please.
I'll move that the Board of County Commissioners recess into executive session at 1:14 p.m. for consultation with an attorney for the public body, which would be deemed privileged in the attorney-client relationship as allowed by K.S.A. 75-4319B2, and that the purpose of the closed session is to protect the confidentiality of the discussion, that the board come out of executive session at 1:24 p.m. at the EOC 10443 U.S. Highway 59, and those present will be the 3 commissioners, finance director, and the county council.
Yep.
Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Passes 3-0.
We can add it next week to do that. Okay, just give us Dan, I can explain what we need to do.
Okay, so are we in a recess and do budget workshop for a bit?
You do this first.
I have a couple things on the county.
Oh, I'm
council.
sorry. Yes, please.
Okay, first I apologize, I should have spoken up before we were talking about the budget with the mental health center. There are several statutes that deal with funding for mental health, and all of them that apply make that a discretionary expenditure by the Board of County Commissioners. So there's no requirement that you fund that you fund the guidance center. My understanding is that all 105 counties, however, do fund mental health services in their area. I probably should have said that before when they were here so that they could hear that. And so I think I'll probably send an email out to them so they know that that's where you're coming from. I'm not suggesting that you shouldn't fund it. That had been part of the discussion that you had she wanted to know whether you're required to support outside entities as part of your budget process. Second, there's been a question about the lease purchase. Everything is ready to go except the bank needs to have a person designated by the county to sign on behalf of the county. That could be, well, I would suggest that be Joe Snyder at Road and Bridge, so that he can sign all of the documents, and if that's approved, that needs to be reflected in minutes, and then we should be able to close that next week. So would suggest a motion to designate Joe Snyder to sign all the lease purchase documents related to the 2018. So Kenworth, is that what we're on?
I think that sounds right.
Okay, I'd look for a motion to allow Joe Snyder to sign all lease purchase documents, with first option? Was that-
First option bank.
With first option bank.
Related to acquisition of the 2018 Kenworth T880 dump truck.
Thank you.
I should.
So move.
Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Aye, passes 3-0.
On Friday, we got back the abstracting for the tax sale, and I took Friday off, so I haven't looked at it in depth. I did make sure that it got distributed to Roger Denton, so we can get started on the database for it. June 8th is our anticipated filing date for the tax sale. So next week in the meeting, I will ask that you adopt a resolution to authorize the filing of the tax sale, and that's a required step in the process.
Awesome.
And can you just put that on there, or what do I need to do to get that on there? I guess I need to email a draft resolution, so I'll do that to make sure we're on. That's all I have.
So just double check and send it to me in an email just to verify. And I can put it on yet this afternoon.
Okay.
Yeah.
That just triggered a memory for me of, I forgot it in my commissioner comments, but I received citizen feedback asking, since the county commissioners are start the price for the properties at the tax sale, will the price be an amount high enough to weed out individuals who just want to own a piece of property? The delinquent tax properties need to be sold to individuals who will 100% maintain the property and pay the future taxes. Now, one of the things I've observed after attending them the past few years is, even though the minimum's $38, we walk away with many not sold. So I don't know that it's really the price. And then also, with that being said, the ones that are of interest bring well over the minimum price. So I want to acknowledge when I get a question, but also didn't know if you had any other input other than what I've observed. Like, the $38 is a placeholder, as a starting point, but usually.
Well, that's the price for recording a deed, which
So
is
you're-
where we came up with it.
Got it.
There are counties that do set a minimum bid that is higher than that. I understand that Wyandotte County puts the minimum bid at the total amount owed, and that's because they want to control who it goes to. So all of their properties, unless somebody's willing to, unless it has enough value that somebody would pay all of that at the auction, it gets transferred to their land bank, and then their land bank makes decisions about how to transfer the property. I think Jefferson County, had a $200, and they ended up with a lot of properties that did not sell. So I don't know if there is a great answer. It does seem less so. I don't recall seeing it at the last sale, but there had been at some sales prior where somebody just showed up and hadn't done any sort of background. wow, I could buy property for $38, and bought a few. In fact, we sold some on the last tax sale. I think we sold 4 or 5 tracts that had all been sold to the same person who bought them that way, and that was a person that then moved away and was a little difficult to find for service and process, but and never paid taxes on the property, so we put it back.
That is a risk. I mean, but I'm for, I mean, the way we've been doing it.
Yeah.
Ultimately, I think if they sell cheap enough, that someone could be a neighbor that maybe they don't have a lot of finances, but if they could get it for $50, they'll be willing to mow it and maintain it just to keep it clean and add it to their own and keep the weeds down and things. So that, to me, to get it maintained, and if they can make the, pay the taxes, usually on a vacant lot that isn't too high, I think it's a win-win.
Yep.
'Cause somebody's got to keep it mowed and brushed down in trees. And
No, I just appreciate you guys' feedback, because I want to acknowledge it, but like what we've observed is hasn't really been a problem with the minimum. Usually they exceed that or don't sell. And so, yeah, so. Okay, so we want to we want to recess into budget workshop.
for how long? Or do we have
I don't think
time?
I don't think we know. So we'll
I don't
just.
think you're required to state anything, you're just not, but you will not make any, there won't be any motions made during that time, as I understand it.
Okay, I'll make a motion, we recess into executive, or into budget workshop.
Second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Passes 3-0. We will recess into budget workshop with financial. Okay, we are back in open session. I have our ARPA forecasted expenses presented from the financial director to go over and look for approval. $23,211.34 left for the balance of the SAN upgrade project from 2022 for IT. It was an IT budgeted expense paid out of ARPA. $106,920 from EMS to remount ambulance, which is expected for December of 2023. $24,280 to pay for engineering with Creel, Clark, and Seifert for a road and bridge facility. $100,773 to Lloyd Group for consulting services for our ARPA allocations and spending. $300,000 to replace fire alarm and graphic panel upgrade for the Atchison County Law Enforcement Center and the jail. $80,000 to purchase and install natural gas generator at the courthouse. $2 million for road and bridge facilities. $101,523.75 for courthouse renovations. That leaves $0 left to allocate for our ARPA allocation for Atchison County. Do I have a motion to approve these forecasted expenses?
So move.
I'll second.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Aye, passes 3-0. And we can all sign this and then we will hand it down for the clerk's folder. I guess I should, date it.
Yes.
And then the financial director will notify.
Yes, the Lloyd Group.
The Lloyd Group,
Yep.
that everything's allocated.
Yep, and I'll
as-
send her the minutes once they're approved.
Okay.
Along with the sheet.
And also send notice to all of the outside
Yes, the
entities.
external
Yeah,
asks
perfect.
that Atchison County received.
Okay. All right, so, public comment. Do we have any public comment? Seeing none, do I have a motion to adjourn?
So moved. Second.
It's been moved and seconded. All those in favor say aye.
Aye.
Aye, passes 3-0. We are adjourned.